the College of Health is doing things differently in that we are really matching demand and student interest for a healthcare environment that's going to look really different than it looks today.
For many years, the healthcare industry has worked in silos. And so you will have your physicians working in one area, you'll have your psychiatrists working in another arena, you'll have your counselors, your social workers, your physical therapists, your occupational therapists. And so that was disjointed.
We know that the future of health is holistic interdisciplinary medicine, and I think that that is an important piece of what we do here.
When you have resources to do what you want to do, the ability to do things differently because we're not afraid of change, and you have the support from the people here on campus to think up and dream up anything you'd like, the sky's the limit. Our new exercise science and physiology labs have the greatest biomedical equipment to measure body composition. Our high fidelity and mid fidelity labs in nursing, right? These mannequins provide experiences for our students that really mimic real life.
Our sim labs go a little further with the whole encounter, the whole experience. How are you dialoguing with the patients? Are you communicating effectively? Are you listening to them? Are you anticipating needs? Are you responding in ways that make sense in the moment?
Advances in technology kind of prepare us students to give us the most realistic experience we can without even having to go into a true hospital setting.
Any successful healthcare education program has to rely on their healthcare partners in the community. Not only do we have affiliation agreements, but we have partnerships, and I think there's a difference. There is a constant stream of dialogue back and forth of what do you need as a healthcare organization, and then them coming back and saying, what do you need from us from experiences? And I think that that's one thing that's really special about being here in Cleveland, Ohio, is that we are surrounded by some of the top healthcare organizations in the world.
I didn't know what I wanted to do when I came to John Carroll. Because we have Cleveland Clinic, UH, and Metro down the street from us, I was able to shadow physicians and get internships in research and volunteering at these hospitals that allowed me to see medicine in all different types of lenses and then discern from there. John Carroll is in the center of all of these awesome opportunities. You're able to be part of that web.
John Carroll caught my attention because the connections and the networking that this school has is second to none.
When I see that somebody is a graduate of John Carroll, I always grant them an interview, and I have for years, even before I was on the board.
It's really exciting to have support from not only the people here, but the people in Columbus and Detroit and Texas. John Carroll is everywhere.
At John Carroll, you do have a value system that aligns perfectly with healthcare. It's compassion, it's dignity, inclusion, respect of ideas, respect of different cultures when you're delivering care. All of those things really make a difference to future employers, and it's the real package.
One of the ways that we've piloted preparing healthcare individuals for the future, we started enrichment programs. We see them as the power skills. We've implemented equity, diversity, and inclusion, innovation and entrepreneurship, self-care and resiliency, and our professional development. They provide this deep dive into these topics that will help create and empower a different healthcare professional of the future that will be more resilient, that will be really thoughtful about health equity and diversity, and be very innovative in how they approach these and have the leadership skills to do that.
I think JCU is different. Plain and simple, I think we are given the resources to thrive. John Carroll has just truly given me everything I could want in a university, and I'm forever grateful.